Hello everyone, welcome to our channel Nursing with Jinsi. Today, very basic topic, that is pre-operative and post-operative nursing care. Okay, so what is the meaning of pre-operative care? Pre means before and post means after, right? So pre-operative nursing care means which are the nursing care we need to give to a patient before performing an operation or a surgery. Okay, then post-operative care, just after an operation, what are the care we need to give. So here my question is, what are the nurses' duty or nursing responsibility? Okay, so let's start with the topic pre-operative and post-operative nursing care. Related to pre-operative nursing care, we can divide it into 3 sections. Okay, the first one is pre-operative assessment, second one is pre-operative education, third one is pre-operative preparation and medications. Okay, so first let's start with pre-operative assessment. The patient or any person coming to the hospital, we need to do first is an assessment before starting with any treatment, before fix for any surgery. We need to assess the patient, right? So here also pre-operative assessment means first we need to assess with all the health history. Okay, history of the patient include what any previous medical condition and now any existing condition and any previous medication or any present medication patient is on any medicines. For example, sugar, blood sugar or blood pressure, for any medicine now patient continuing or any ongoing medication. Okay, and do with a physical examination. If patient has any sort of physical problem or any deformities, etc., we need to do the physical examination and assess with the family history, socioeconomic history, and any food allergy, any medication allergy. These all we want to do before the surgery. Okay, these all care comes under pre-operative assessment. Okay, now coming to pre-operative education. Pre-operative education means so many points we want to educate to the patient or so many things we want to instruct to the patient. Yes, according to a patient's condition or according to the health situation, doctor already decided to do a particular surgical procedure. So now education, first we want to instruct your patient or educate your patient is what is a procedure or what we are going to do for you according to your disease condition. What is a treatment regimen now we selected or the particular we are going to perform for you, that you have to explain to your patient. Okay, because patient has a rights to know their own treatments, right? Rights to select, a right to refuse, everything. So we need to respect with patient's rights. Okay, so second point is the procedure, how we are performing. Okay, it's a minor surgery or it's a major surgery, or how we are performing. That procedure takes place in the operation theater or OT, or we can do in minor OT, or we can do in OPD session. So how we are performing, that also we need to give explanation to the patient. Okay, then coming to for what purpose we are doing, right? What we are performing, how we are performing, and for what purpose. For your disease condition, this is a better choice. So this we are performing for this purpose. Okay, so this also we need to give explanation, that is as a part of our health education. And this pre-operative education, one another very important thing is post-operative care instructions also we need to give to the patient during this time. Why? Because after the surgery, patient may be under sedation, right? Okay, will perform under general anesthesia or local anesthesia. Okay, according to that, you need to give information. Then immediately after the surgery, you will be under sedation for few hours, maybe 6 to 8 hours you will be under sedation. That time you will be unconscious. Okay, so this thing also we need to inform to the patient as well as to the family members. And another second thing is any tubings after the surgery. Patient's body is connected with any tubings, that must be you inform during this pre-operative education session. Why? Because after the surgery, patient may relieve from the sedation. Patient will wake up. Suddenly, patient will see all the tubings, maybe urinary catheter, maybe any drain tube from the abdomen or from the abscess drainage area. Any drain tube is connected. Maybe the nasogastric or Ryle's tube is connected through the nostrils. So suddenly, the patient will wake up and seeing this all tubings or connections. How the patient may feel? Really, patient may feel like panic. So in order to avoid and also make a knowledge with these with the family members also, so they will be more understandable with the condition, right? Okay. How many days you will be in the post-operative ward? Okay, then your vitals will be monitored every 15 minutes, and after that your all vital signs are normal, then your drain are okay and your consciousness, your pain is okay, that's the time only you will transferred to your particular ward. So these are all the post-operative care instructions also. How many hours after you can eat, okay, that also you must inform to your patient. And now coming to pre-operative preparation and medications. Okay, this is a very important session because some patients may be diabetic or hypertensive, they still on medicines, right? So pre-operative preparation or pre-operative medications means this time is very crucial, preparing for the surgery. Okay, after this session we are transferring our patient from our ward to the operation theaters. So pre-operative preparation, what are the elements? First one is we check with the jewelries. We want to remove all type of jewelries from patient's body. And we check with patient has any pacemaker or patient has any artificial dentures or any body implantation. Okay, patient has or not. Okay, next is we want to do the preparation of the local area of the operation or the surgery. For example, we need to do any abscess drainage. Related to the abscess formed area, we need to prepare for the surgery or incision. For any abdominal surgery, we need to do shaving and cleaning with the aseptic techniques, and we need to give our operation theater gowns for the patient. Another comes under preparation is with the medications. Some medications we no need to continue that day. We are posted for the surgery that day, we no need to continue, but some medication we need to continue. So what is your special responsibility as a nurse? You consult with the surgeon and make a prescription. What are the medicine to avoid and what are the medicines I need to give to the patient just before the surgery, before transferring to OT. Then patient must be under NPO. NPO means nil per oral. We cannot give any food through mouth. We will maintain the patient on IV fluids only. And also we need to prepare the patient with enema. Why enema we are giving? In order to empty the stomach. Signing with a surgical consent. Okay, so that may be not with the preparation time when we are fixed for this patient a particular surgery. That's the time itself we can do, but at least pre-operative preparation time we must ensure that patient already sign on their surgical consent. Why? Because this is for the legal purpose as well as for our safety purpose and also for patient's purpose. Patient already know what are the procedure we are going to perform, then make a sign. by the patient as well as from the family members. If there is patient has any risk with the age or any associated disease condition, these all points we are included in our surgical consent. So make sure with patient already and family member already sign on the consent. Okay, then we transfer our patient to operation theater. So these all comes under pre-operative preparation. Okay. Now coming to post-operative nursing care. What are the things comes under as nursing care or nurse's responsibility during post-operative care? Immediately after from operation theater, patient will be posted in the post-operative ward, right? So in the post-operative ward, patient will be admitted. Closely monitor your patient. For what are the things? First, closely monitor with the patient's vital signs at least in every 15 minutes. Okay, including temperature, pulse, respiration, oxygen, blood pressure, blood sugar, everything. Okay, so monitor. And second one is monitor patient's consciousness. Okay, why? Because still patient may be under sedation. So next one is assess or monitor the surgical site. For what? Assess for the suture is okay and assess for the skin is okay, or there is any signs or symptoms of infection of the surgical site. Okay. And if there is any drain tubes or urinary catheter or Rice tube or nasogastric. So if there is any tubings connected on the patient's body or on the surgical site, means you must every time for the drain. Okay, drain is the amount, the color of the drain and the consistency, etc. Okay, then according to that you have to assess with the intake and output chart of the patient and how much is the IV fluid we are giving and for your patient in your post-operative nursing care, and do a proper documentation. Each and any nursing care, any type of care you given to your patient, your responsibility immediately after that particular care you have to record in your patient's record or patient's file. Okay, for the future reference as well as for the comprehensive care for the patient. Okay, so these are the things you need to take care with any operation as pre-operative and post-operative nursing care. Okay, I hope you got some points from our video today this much, and we will continue in our next video session.